talking about the radial artery in the arterial supply or the oxygenated blood supply of the palm, then we must consider the fact that there are two arteries. One is radial and other is ulnar. Now the radial artery gives off a branch and it does form something called a superficial palmar arch. What is superficial? Superficial means on the outside, on the surface. So there's on the palm there is an arch. Arch means curvature or curving. So the radial artery would form the superficial palmar, and it will go and meet in the deep palmar arch with the ulnar artery. Now when we will talk about ulnar artery, it's right down there, but before we talk about ulnar artery, we must consider the fact that radial artery gives off a little branch called princeps pollicis. Yes, princeps pollicis artery to the thumb, to the big finger, large finger, which we call thumb, and also from the princeps pollicis there are radiating fibers adjacent to that, which are called radialis indicis, index finger to the index finger from the radial artery, so it will be called radialis indicis. Also, the radial artery is not only responsible to supply the hand in only the palmar direction. We have earlier talked about the superficial palmar arch coming off of deep palmar branch of ulnar artery. Now we earlier said that the ulnar artery, which is responsible, first it goes in the deeper part of the palm, and then it will rise up and form something called, in a curvature shape, it will cause an arch which would be superficial, which would be in the anterior, or let's say forward aspect. So when we say forward aspect, we must consider the fact that superficial palmar arch would be responsible to give out some of the arteries, which are called the arteries to one of the individual finger, or let's say common palmar distal artery. Now why it's called common palmar? Because these arteries will give out branches to each of the fingers.